All right, you're watching the Power Hour, and my next guest is becoming a regular on the show, and she needs no introduction. I think it's like her third time on. Ladies and gentlemen, please welcome Pamela Garfield-Jaeger. Pamela, how are you?
Hi, I'm great. How are you?
I see you're doing wonderful. You have a nice backdrop there.
Yeah, it's new.
I want to jump right into it because I love your theories and what you have to say on the subject matter, and it's very interesting. And I want to start off with your beliefs on children feeling as if they were born in the wrong body.
What are my beliefs?
Yes, what are your
Do
beliefs?
I think do I think children are born in the wrong
Yeah,
body? The short answer is no, I don't. I think there are children that feel as though they're born in the wrong body, and I think that's a really genuine feeling. And my belief is I think we need to help those children because they're usually suffering from something, and often there's another issue going on, like they've maybe had sexual assault, or people who have some really severe early attachment issues like foster kids. They tend to more likely feel that really strong belief that they're born in the wrong body.
right.
So that's
So
what I
it's
believe.
it's always an underlining issue you believe
Hmm.
that causes that feeling. Um, what strategies would you employ to respectfully disagree with the child's perception of their gender identity?
Yeah, I mean, it's hard because usually when someone believes that, it's a really intense and strong belief. So it's hard to just go at them and say what they believe is wrong. So usually what you want to do is really listen and be present with them and ask open-ended questions about why they believe what they believe, what it means to them, and then have a back and forth and really be curious and help them think about what's really going on for them, especially if you might know that there are other issues, if they have an eating disorder, if they have severe anxiety or depression. You really want to help them with those sorts of issues, because oftentimes when you resolve the other issues, the intense feeling of being wrong in the wrong body will also resolve.
Right. Now, have you ever encountered someone that you had this conversation with, discussing their gender identity crisis? And if so, what was that conversation like?
Oh, have I talked to people
Have
who've
you ever
had?
spoke to someone who felt like, who felt like they were born in the wrong body and they was having this
Yes.
identity crisis? What was that discussion like?
What was it like? Well, oftentimes they're not looking for my help to change that. So I haven't actually worked with someone that's looking for help. I believe I'm not going to change someone who's not looking. But if it were someone in my family and someone that I really cared about, then I would be trying to talk to them about it.
Right.
So it's hard, honestly, because
It,
they really have a really strong circle of people that are telling them a different message. So it's not easy.
right. Yeah. I'm pretty sure it's not. Once their mind is set on it, then it's set
Hmm.
on it, and it's pretty much nothing anyone can do to change it. Now, how do you create how do we create a safe and inclusive environment for children who express their feelings about their gender identity? Even if you may disagree with their perspective.
Yeah, I mean, just like we always used to do without forcing it. I think we are a respectful people and we're caring and compassionate people. I don't believe in reinforcing lies, but it's also not usually helpful to combat them. So I think we need to skip the pronoun use and skip the names and the rituals, because a lot of that has it backfires. So if we can really treat people with respect, if we can really listen into those clues, um, for example, actually, I was wrong with that other answer, because I did talk to some kids in this program and they were talking about their trans identities, and they admitted to me that they were using it to feel a little sense of power, because they were feeling powerless in their lives. So we talked more about that issue and those ideas and less about the trans issue at all. So what it is kind of what I was saying is, you want to talk about what's underlying
Right.
and be there for them.
And I ask you, and I always ask you this question. I'm going to ask you again. Are you anti-trans?
So this is what I'm going to say. That is a question that I know not you're not trying to do, but when people ask that, they're often doing that to shut down the conversation.
Right.
When you ask somebody if they're anti anything, as opposed to looking at them in good faith and looking that they actually care about the topic that they're talking about, that is the question that is said to shut it down. So I'm actually not even going to directly answer that, because that would just make me be put on the defensive. So I
Right.
want people who are asked that, who agree with me, to think about how they're just being asked that, or they're being labeled that, as a way to shut down the conversation about just caring about children, caring about their well-being, caring about their health and their long-term futures.
Right.
So yeah, if you want to call me anti-trans because I actually care about children and I care about their future and I care about people living in a world of truth, then in a way you could maybe even say yes.
Now, the biggest thing with you, I believe, is the surgical procedures that you really have an issue with.
hmm
Can you explain your perspective on why you're against surgical procedures for the transgender individuals?
Well, they come with a lot of risks, and once you really learn what they are, they're not as nice as you think. Truth be told, just a couple of years ago, I was kind of naive to this. I didn't think it was that big of a deal. You almost have this magical thinking. You have a surgery and boom, everything's great, but it
Right.
doesn't work that way. A lot of these surgeries, most of them are experimental. They are experimental, especially what they call bottom surgery, which is when they change the genitals. That none of that is approved by anything. And when a person goes in to get those surgeries, they're basically signing all liability away, because they come with a lot of complications. They come with infections. If it's done on a woman or a girl, then they have to graft skin from another part of their body, usually their arm or their thigh, and then that area of their body often has severe complications. And if you were to Google it, it's quite graphic and ugly. And for a man, honestly, it's even hard to talk about, because these surgeries are so graphic, the way they
Yeah.
have to do it. And it causes lots of pain, urinary problems, sexual dysfunction, of course. So no, so I'm very uncomfortable with these surgeries. And then even the what they call top surgery, which is when a woman gets their breast removed. This is being done on youth as young as 12 years old. And no 12-year-old can consent whether they know they're going to have kids and breastfeed when they're older. So that in of itself is a huge problem. But they also come with a lot of pain and a lot of complications. They end up with infections. They end up with the bruising. There is one detransitioner who's been very vocal about how she still has sort of oozing from the scars that she has. A lot of people who lose their nipples, which is an important place of sensitivity, and people usually have a lot of numbness. I mean, I could go on, but they're not as glossy and beautiful as they seem on the internet. I'll just
Right.
say that.
Right. And a lot of it, well, most, I don't know the percentage, but it's irreversible, most of these
Of course.
procedures, right?
Completely
Yeah.
irreversible. There is a doctor who's famous for saying online, if you get your breasts removed, you could just go get new ones, as if that's the same thing. First of all, you can't get new breasts that actually work, that you can have sensation in,
Right.
no matter what. But if you were to get silicone implants, it's actually a really difficult process, because when you get the trans surgery, they do move your nipples around or remove your nipples, and none of that can be replaced.
Right. Now, what role, if any, do you think societal attitudes and stigmas play in shaping views on transgender surgical procedures?
Well, I mean, no, most people aren't aware of these complications, so they
Right.
don't really think it's a big deal. I think most people have kind of a more libertarian point of view, where it's sort of like their body, their choice. But I think if they knew the truth, especially when they recognize that it's vulnerable people with really severe mental health issues that are falling into this because they're looking for a quick fix for their pain, they might not have that attitude. So that's really why I'm out here speaking, to educate people. So I think once the public learns the truth, then they might have a little more passion like I do.
Yeah, you're out here speaking and you're doing a great job because you're everywhere. I noticed every time I turn around, you're everywhere. I mean, you're doing a great job. Now, how do you think the healthcare providers should approach the topic of surgical procedures with transgender patients who are considering getting surgery?
Well, they say that there's this thing called informed consent, that patients get informed consent, but none of the patients are actually informed of very much because they're told this big promise that you get this surgery, you're going to feel better. This is going to create your true self. And they never are told, well, there are also these complications. And then it also might even increase their dysphoric feelings. So this is supposed to alleviate their feelings, at least let's alleviate the feelings of gender dysphoria. But what often happens, for example, a girl might get her breast removed and then she might feel a little better about her chest, but then she looks down and sees the bottom half of her body and feels even more uncomfortable and more dysphoric. And trans people will actually say this out loud. This is what happens.
Wow. Yeah. Now, before I let you go, I want you to plug the book and the documentary, which I still hadn't had a chance to see yet. And I'm going to watch it as soon as I get time because that documentary, it looks amazing. And we're going to run a clip shortly. But tell us about the book first.
Okay, so I've written a book. It's called a practical response to gender distress: tips and tools for families. And this book, it's written for what I say are the normies, which I think are most people who
Right.
aren't as immersed in this topic. There are people who really immersed in this topic, and then there are people who are regular everyday people who are normal and don't understand just how intense and how dangerous these things are and how many lies are being told to the general public with slogans and with fake data and pride flags on the White House, and how we're all just sort of in this daze believing that this stuff is okay. So my book really talks about a lot of the lies and then what you can do if someone in your life or someone in your family is captured in this belief that they're born in the wrong body, and how you could talk to them. It even has a lot of other resources. It includes that film that you're referencing and many other films, other documentaries, other TV shows, other books for children and adults that address this topic. So it's really a place for you to go if you really want to learn more about this topic, away from the general lies that are being told to the public.
All right. Now, here's a question I've never asked you. What drives you? How did you even get involved in wanting to pursue this topic?
Yeah, so I mean, I think I would call myself a bleeding heart liberal still. I am a social worker that always cared about children. I've spent so many years working with vulnerable kids. I've worked in foster care. I've done work with kids who are severely abused. And these are the kids that are really being enticed to become trans. And they're the ones I feel that they break my heart to hear that they're going to live as a lifelong medical patient with sexual dysfunction, an inability to have children, inability to create families, and still be left with the trauma that they had in the first place that they're trying to resolve with this fake promise. So I've gotten really passionate about that. And the reason, the way I got woken up to it was when I started working again in a program with teenagers who were having severe mental health issues. Half of them were suddenly identifying as trans, and I could tell it was not organic. And I learned that it was because of things they were seeing online, and that other adults in their schools and other therapists that are in my profession were reinforcing that. So I felt a heavy responsibility because my profession is basically creating suffering for children and vulnerable adults.
Right. And the documentary, which, like I said, I can't wait to see. Uh, Tell us about that.
Yeah, it's by a company called Epic Times. It's called Gender Transformation. And what's special about this film, it's even though Epic Times is known for maybe a certain political leanings, this film is done by a Swedish director who has no affiliation with any Republicans or Democrats because he's from Sweden. And it is a docudrama. So what it does is it pulls you in really well to a real life story of a family who was very much harmed by gender ideology. And it helps show you that this isn't the rainbows and glitter that people believe it is. It isn't all about kindness and acceptance. And once you learn the truth, and this documentary really does a good job of showing you and helping you feel the truth and how many people have really been hurt and have suffered from things that we naive, myself included, used to believe is okay.
Right. Ladies and gentlemen, Pamela Jaeger, thank you so much for joining me on the show. It's always a pleasure having you on the show. We have to do it again.
Thank you.
All right, you're watching the Power Hour right here on Soul TV.
The Power Hour is brought to you by Soul TV.